I am Dr. Sharda Jain. I am Secretary General of Delhi Gynecologist Forum. I have taught for 2 decades at PGI Chandigarh and Lady Hardinge Medical College. We run top training course in the country for infertility in IVF under the aegis of Delhi Gynecologist Forum. Many neighboring countries' gynecologists also attend the same. Now, in this series of educating patients who are seeking IVF in infertility and IUI, it's our small endeavor to help them out with knowledge. Today, I'm going to tell you about A to Z of intrauterine insemination. It is step-to-step guide for yourself. 4 things are essential. Husband should have semen, sperms. Lady should have eggs. Tube should be patent, at least one tube should be patent. And tuberculosis should be ruled out. Now, when the patient comes, assessment before undergoing IUI is required. That means thorough assessment of medical problems, examination, and the couple should have few fertility tests, which I've just now mentioned. A baseline ultrasound is needed to assess the pelvic cavity. There is no evidence of infection, no fibroids, no endometriosis, for the uterine lining, for number of follicles, and for any evidence of infection. This can be done in the beginning of the cycle itself or in the previous cycle. Now, after that, we give medication for controlled ovarian hyperstimulation. The question is often asked, can IUI be done without giving medication? Yes, it can be done. The success rate in that particular case with follicle monitoring without medication is around 6%. But if you give ovulation induction agents plus follicle monitoring, fertility drugs like clomiphene or letrozole, then the success rate is around 8%. But if you're doing and using oral ovulogens like clomiphene or letrozole plus combining with gonadotrophins, plus you're doing an IUI, the success rate is around 10 to 12%. If one is using pure gonadotrophins injection for ovulation induction and you're doing an IUI, the success rate jumps to 18 to 20%. So, you are guided how the medications have to be taken, and throughout the cycle the monitoring has to be done. If you're doing a clomiphene and letro cycle, in that case they do a monitoring on day 2 and then day 8. Or people straight away take them to day 12, and on that particular day they say whether the ova will be mature or not, and they will give you a trigger. Trigger is not essential for clomiphene as well as for letrozole. It all depends upon what your doctor feels about it. But if your one is using a gonadotrophin cycle, in that case the trigger is must. These patients do not require any blood test for hormones. Ultrasound is good enough for monitoring. Once the trigger is done, IUI is timed after that particular trigger. The trigger is HCG 5000 international units. Gentleman is told that regular ejaculation is required. On the day of IUI is done, he gives semen in the clinic itself and where it is processed. It is a rule from the time of ejaculation till the time insemination is done should happen within 1.5 hours. And that is why it is mandatory now by the government that IUI processing should be done in-house. The sperm preparation is done in the lab, and again, depending upon what is the kind of semen is there are various kind of tests available which are used for processing the sperms. After the IUI procedure is a very simple procedure, very painless procedure, just about 2-3 minutes happens. Preparation takes a little more time, but the procedure is only 2 to 3 minutes, absolutely painless. After that, we advise bed rest for only 20 minutes. Many people lie down for more than half an hour, but not more than 20 minutes rest is required. Then we give them a luteal phase support. Luteal phase support is given of progesterone, which can be given in the form of oral capsules or a vaginal preparations, which she uses morning and evening. 14 days after the IUI, the urine pregnancy test is done to know whether lady is pregnant or not. Sometimes we use even beta-HCG. Consultation with the treating infertility expert is required after the urine pregnancy test, whether it is successful, in case if it fails, about the future treatment. 3 IUI cycles are usually planned in case if everything is all right, because 3 IUI cycles are equal to 1 IVF. And invariably after 3 IUI cycles, the couple is suggested to have IVF. The number can increase depending upon the patient's circumstances and indications. Here I wish to tell you, when the follicle monitoring is being done, we also make sure that the endometrial thickness is 7 mm or more. No pregnancy will occur in case if the endometrial thickness is less than 7 mm. I repeat again, success rate will depend. If IUI is done alone without medication, then it is 6%. If clomiphene or letrozole is used with IUI, it is around 8%. If gonadotrophins and oral ovulogens are used, it is around 12%. And if pure gonadotrophins are used, it is around 18 to 20%. Hope the information which you got satisfied all your queries and questions. In case if you still have any queries, you're free to visit our clinic and ask. In case if you've liked this particular video, do like it and subscribe it. Do tell your family and friends that there is a YouTube site where you can get a correct information by the senior doctors. Thank you very much.